Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there's one new case of COVID-19 to report. Total number of cases is 284. As of this morning, 5 individuals are hospitalized with none of those in intensive care. 247 individuals are listed as recovered. There are 30 active cases. Yesterday, 543 lab tests were performed, bringing us to 29,343 tests in total. The new case today is attributed to that small cluster of cases in a workplace in Prairie Mountain Health. Number of cases now associated with that workplace is 8. Affected staff and close contacts are self-isolating and being followed up by public health. Again, this does not put the public at risk. The contact investigations are essentially complete, and there's no concern for the public. Should any information come available that would benefit that release to the public, we will certainly do so. We know people are thinking about Mother's Day coming up this Sunday, and we need to certainly celebrate that day, but we need to celebrate it a bit different this year. We need to continue to think of connecting virtually. If we do get together, certainly avoid large get-togethers. It's best to meet outdoors if possible and maintaining that social distancing. We're not done with this virus. We're not back to normal. So please limit those group sizes, limit close, prolonged contact, and certainly no one showing any symptoms, even mild symptoms of respiratory illness, should be attending any type of gathering. The weather is warming up, and people are starting to think about heading to the cabins for the weekend getaways. And so again, I'm advising against non-essential travel outside of the province, but if people are making their way to such cabins, ensure you're limiting your contact with others. Certainly do not travel if you're feeling at all ill. Do fill up near home. Take everything with you that you're going to require on those trips if it's outside of the province. Limit your contact with others. Do not meet in large groups, and then coming directly home. And this certainly applies to those who are traveling outside of the province within close distance to our borders. Certainly people returning from outside of Manitoba, with few exceptions, are required to self-isolate for 14 days. If that's not excluded, such as things like routine travel to your residence if it's near the border. Continue to encourage everyone to get tested who has symptoms of COVID-19, fever, cough, runny nose, sore throat, any of these type of symptoms. You can call Health Links for advice on whether to be tested. As you know, that our numbers, the hard work of Manitobans has put us in a position now to gradually reopen. And again, the key is gradually and cautiously. We're following a number of indicators very closely to ensure that this reopening is successful. We need Manitobans to continue to take this virus seriously, to continue to practice all of the physical distancing strategies that we have in place. Businesses that are set to open are provided with guidelines they can find on our online documents. And this is to ensure that their workers and their patrons attending their facilities will remain safe. And they're all based on physical distancing for the most part. People who are ill should not be attending work. People who are ill should not be receiving services or going shopping. And as we reopen things, as we're changing our messaging from simply stay home to staying safe, it's vital that people who are showing symptoms of illness, symptoms of respiratory illness, do not attend work, do not go shopping, do not attend groups. And that's quite important for our strategies moving forward. Continue to wash your hands. Stay home if you're ill, and if you're out, maintain that physical distancing whenever possible. or messaging to those people who are in the higher risks for severe outcomes of COVID-19, those over age 65, those with underlying medical conditions such as cardiac disease or respiratory disease, and those with immune compromise have to be extra careful. For people in those groups, our messaging is largely remains the same, to stay home for the most part. Leave only for essential reasons. And if you're out, ensure you are taking adequate steps, washing your hands, keeping that physical distancing. We need to ensure we're protecting those that are most vulnerable to the severe outcomes of this virus. Businesses that have any questions about the orders can contact us through engagemb.ca. And Manitobans can continue to access credible information about this virus at manitoba.ca/COVID-19. And so thank you once again to everyone, and I'm going to pass it over to Lanette.
Thank you. Good afternoon, everyone. My name is Lanette Siragusa, Chief Nursing Officer from Shared Health. And I want to begin today by acknowledging the tremendous work that's being done by the Winnipeg Aboriginal Sport Achievement Centre, also known as WASIC. The nonprofit organization is delivering packages to families in need as part of its WASIC Cares initiative. And these packages include information about COVID-19, as well as non-perishable food and grocery store gift cards, protective supplies like soap and sanitizers and wipes, as well as games and activities. These packages are being put together and delivered by youth, which is fantastic and allows them the opportunity to give back to the community and stay connected with their peers at the same time. It's a great initiative that helps families, keeps kids engaged, and reinforces the values of helping your community. If you are interested or in a position to help out this WASIC initiative, donations are being accepted. Priority donations would include cleaning and antibacterial products, but financial donations are also welcome and would go towards the CARES initiative, as well as enrichment programs for children and youth summer employment positions. So if you would like more information, you can email Trevor Laforte at trevor@wasac.ca. So that's trevor@wasac.ca. I also wanted to provide an update on the outbreak that we had at Health Science Center, which to me feels like a long time ago, but probably not for the people who've been living it on the unit. So this began on March 30th, and it was a medicine unit at the Health Sciences Center. And since that time, there's been two rounds of incubation periods that have passed, and we are very happy to announce that infection prevention and control officials have declared this outbreak over. So most of the staff are back at work, and we're happy that they are healthy, and there's a couple more still recovering at home, which we hope to see soon. So I think it's really important just to remember, because it's not just in an outbreak, but when this outbreak was occurring, a number of measures were implemented to contain and stop the spread. And it was effective, and it's important that on a day-by-day basis we maintain that. So cleaning the unit, limiting group activities, minimizing patient transfers, and restricting patient movement within the unit were all strategies that they implemented. As well, of course, visitor restrictions are now in place at all facilities. That helped, as well as screening measures for staff shortly after this outbreak began. So I want to thank everyone who was involved in these efforts. It was a very difficult, stressful time, I know, for everyone, and we're very happy to have everyone back and some semblance of normal there. And last, I just want to acknowledge that it is Mother's Day this weekend, and it will be a Mother's Day we won't soon forget. It's one for the history books. This pandemic has really caused us to look at what's important in our lives, and certainly acknowledging people's contributions and the important relationships is part of this celebration. But given the restrictions and the virus that's circulating, we really want to encourage people to show their love in creative ways, such as messaging through phone, through internet, chats from a distance, potentially windows for those that are in facilities, and for those that are at home or in the community, as Dr. Roussin said, potentially outdoor visits, healthy people only. For those moms who are in facilities, whether it's the hospital or the personal care homes, gifts of food are still allowed as long as they're dropped off for patients and residents in plastic, wipeable, and disposable containers. And as well, any personal tablets or phones that can be wiped, as well as clothes that can be laundered. So there's different ways we have to be creative with this holiday. Everything we can do to limit the spread of the virus and support cautiously and slowly reopening is our goal right now. And I do also want to say we continue to look towards modifying those visitor restrictions in the near future as we get back to a semblance of normalcy. So I want to thank everyone for your patience and your understanding, and encourage Manitobans to celebrate virtually for now, or at least at a distance. And we look forward to the gifts and the celebrations when it's safe to do so, especially for those in high-risk environments right now. And with that, we will open the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon from the Brandon Sun, Bud.
Hello, it's Bud Robertson, the Brandon Sun. This one for Dr. Roussin. Can you go over a little bit where in the chain in this cluster the new case was? I'm thinking, is it another employee, or is it someone in the contact tracing from the first group, or the second follow to that? You understand what I'm asking there?
Yes, yep. So there's 8 people involved in this cluster. There are 6 of them employees. 2 of them are close contacts to those employees, including this case is one of those 2 that is a close contact to that employee.
So you said 6 employees, 2 contacts?
6 employees and 2 close contacts, yes.
Okay. And this one for Lanette. Happy Mother's Day coming up, by the way. Regarding N95 masks, the purchase of 1 million, will this be sufficient to carry you through for the foreseeable future? And when do you think the first shipment will come through?
Yeah, so N95 masks, as well as some other supplies, continue to be a challenge. So we'll see when they come in, if they come in the quantity at the time that we were hoping. And once those N95 masks come in, we will have to go through the process of fit testing the staff to make sure that those masks fit around their faces and provide the adequate protection that we believe is the standard for them to keep them safe. So we will wait for that shipment to arrive. I try and keep my expectations managed given this global pandemic and challenge that we've been facing. So we'll see. Every little bit helps, absolutely. I have checked in with our logistics team recently, and they feel like we are in good shape for the next couple of weeks at least. We've also been modifying our PPE guidelines, so just to make sure that we are using our supplies appropriately, so that continues to happen. And still working through the 3D N95 masks that we actually can make here in Manitoba and also reuse. So it'll be a multi-pronged strategy for, I think, the duration of this pandemic to make sure that supplies keep coming in the quantities that we require.
From CJOB, Clay.
Hello, folks. Has Manitoba Health or the province received any feedback at all as we're nearing the end of week one of phase one of reopening the economy? Any positive feedback, any negative feedback that you know of since Monday?
Yeah, no, I haven't received any specific feedback or significant negative feedback. I think I think a lot of places we're trying to ramp up to open safely, and so I think there's a lot of reopening going on. I think it's being done in mostly following our guidelines. We have a lot of inspectors out there ensuring that and providing education where necessary. So I'm not aware of any specific issues as of yet.
All right, that should do it. Happy Mother's Day, Ms. Siragusa.
Thank you, Clay.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here from the Winnipeg Sun. Question about the N95 masks. I guess so they're all from a place here, I guess, like made in Manitoba here from a place here in Winnipeg. Are they distributing these masks to other places as well? Is that why there's maybe some uncertainty on how many you'll get and when you'll get them?
Are you talking about the 3D masks that we are producing in Manitoba, or are you talking about a shipment that we expect to come in?
The shipment, is that one not from the place here in Winnipeg?
Yeah. So the thing with the N95 masks is they need to be fit tested when they arrive here. And normally one of our main suppliers, I'm not sure if I'm allowed to say this, but it was 3M. And so we still are receiving supplies from them, but also from different suppliers. So we've talked before about how we've gone from 60 suppliers to 600 suppliers now. So we are procuring our supplies from broader distribution of vendors. And when those supplies come in, not only do they have to be suitable quality, but they also have to be suitably fit tested. So whether they come from Manitoba or they come from the States or they come wherever they come from, that is a process that we have to work through when they arrive. So it takes some organization to get them into circulation.
Okay, and then just a follow-up to that then, it seems, or at least from the release that the province announced this morning, they can be reused up to 30 times. Are they then just given out to, how is that, I guess, tracked in terms of the reusing them and I suppose making sure, one staff member keeps the same mask? How does that whole process work?
Mm-hmm. So, depending on which type of mask, so not all of them are reusable, some of them are disposable, and some of them are reusable. And so it depends on the mask and the type of cleaning, how we would clean it and sterilize it for reuse. So specifically, did I answer your question, Scott?
Yeah, I was just wondering, I guess the release this morning said 1 million made in Manitoba reusable N95 masks, so I'm just wondering if all those masks, based on that release, would be of the reusable sort?
Yes, I believe so.
From CBC Radio Canada, Laisa.
Yeah, Laisa, CBC Radio Canada. My question would be to Dr. Roussin. I want to know if there's any point that the province is looking to distributing the mask to the population, or putting a maximum price at which masks can be sold in Manitoba.
Sorry, that was about wearing masks, was it?
Yeah, wearing masks is if the province is looking at distributing masks to the population for free, or having putting a maximum price at the mask that are sold in Manitoba.
Right. Yeah. So with the non-medical masks again, so they certainly they can be worn by people, especially if they're going to be in positions where they just can't maintain physical distancing. They're not a substitute for all the things we talked about. Not a substitute for staying home when you're ill. Not a substitute for washing your hands. Not a substitute for trying to maintain physical distancing at all times. But in addition to those things, they can be an added benefit. And so as more and more use comes up, there will probably be some demand for those. At this point, we don't have plans of providing those to Manitobans at this point. But as things move forward, we'll be continuing to look at options.
And with the cloth mask, the non-medical mask, they should be washed in hot water, as hot as possible, and still care always to wash your hands when handling the mask, when you're taking it off especially, and remembering that the mask doesn't protect you, it protects those around you.
Thank you. And about the Manitoba-made mask that the province announced this morning, when are you expecting to have the first delivery of that mask?
So are those the non-medical masks that you're talking about?
The 3D mask.
Oh, the 3D mask. Yeah, so there's quite a process to go through, and they've been working really hard to jump through those hoops and make sure that they are up to standard and quality. And ultimately, they have to have final approval. It's actually going through Health Canada to make sure that we can safely use them for our staff. So we don't know when that'll be, but we're hoping very soon.
From CBC Manitoba, Aidan.
Hi, Aidan from CBC News. My question is for Dr. Roussin. I just wonder if you could provide a little more clarity. I believe yesterday we heard that there were 5 cases. 5 of the cases in the cluster were among employees, and 2 cases were close contacts. And so today now we're hearing that there are 6 cases that are employees and 2 are close contacts, but the new one is a close contact. So can you just get a little clarity on that breakdown?
Yeah, I think so. That's the update I have of this morning. Is that there is the 6 employees and 2 close contacts, and so I'm not sure if one had was determined later to be actually involved in the workplace, but the update I have of this morning is 8 in total, 6 in the workplace, 2 close contacts.
Okay, thank you. And my follow-up is for you again, Dr. Roussin. And another branded employer, not this specific cluster or workplace that we'd heard about earlier, but a second branded employer has confirmed yesterday that a gas station employee tested positive for COVID-19. And I'm wondering if you can speak to whether that case is linked to this cluster. We've got lots of questions on that.
Yeah, so I won't give out any information like that, because that could certainly potentially identify a person. So what we would say is the same as always. If there was a reason that the public would be at risk, then we would certainly be advising them. Many of our 284 cases to date have been employed, but we've been able to do contact investigations, follow close contacts, and identify them. And most times we don't need to identify an employer to protect the health of Manitobans. So that applies here as well.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, just to follow up on Aidan's first question. The cluster in western Manitoba, I'm phrasing it in a layman's way, but is everybody who has tested positive so far either an employee or 1 degree of separation away from the workplace?
That's right.
So the alternative would be like a chain, somebody 2 or 3 degrees separation, but these are all direct contacts with that workplace or 1 degree of separation, correct?
That's right, and in fact, only close contacts of the very close contacts of the employees. So we don't have any further transmission chains from that. It's just the this one secondary transmission.
Okay. And a follow-up question: the government, last we heard, was still planning on opening a testing site at that Thunderbird House in Winnipeg. Is that opening? Is that opening soon? And have there been any challenges in getting that up and running?
No, it was announced, and we were expecting it was going to take a couple of weeks to get up and running. I haven't been notified of any challenges, but I can certainly follow up, and I'm expecting they will be open in the next week or so.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. This question is for Lanette. I'm wondering if you have an update on how many cases were linked to the medical HSC unit outbreak.
Well, we know there was 12 staff, and do you know what the total number was?
Don't have that on me, no.
No, we don't have that available, Michelle, but in total it was 12 staff.
Okay, thank you. And Dr. Roussin, you say that the contact investigation for the Prairie Mountain Health outbreak is done. Does that mean you know where the index case was contracted now?
Yeah, I don't think I don't have information on that. I'm not sure if they if we do know that may have been a case that we can't link to a known case or to travel. I can't confirm that though, but certainly that investigation of the index case is definitely done.
From City News, Jonas.
Good afternoon, Jonas Gilbert, City News. Dr. Roussin, just some clarification on your remarks earlier on interprovincial travel. Did you allude to a loosening on the self-isolation restrictions for folks returning?
Yeah, it's not a loosening. The order has always had the exclusion of routine travel to neighboring communities, and routine travel included attending your own property. So there's been no change to that for sure. And so again, the advice is to avoid non-essential travel outside of Manitoba. That's the advice. The orders have some exclusions, such as attending your property nearby in neighboring regions. But if you're leaving the province, it should be really take everything with you that you need. Limit your contact with anyone else there. Certainly don't attend if you're ill. Certainly don't attend for health care unless it's absolutely necessary. And then travel back straight.
Thank you, sir. Follow-up for Lanette. Lanette, this is actually one of my colleagues. She's working with Transcona Optical, a local establishment that's creating face shields for frontline workers. Just wondering if you could talk about the importance of the actual device they're creating, what it means, and also the impact that local businesses are having helping out the local healthcare sector.
Are you specifically asking about face shields?
Yeah, if you can. That'd be great. Just to,
Yeah, so we have developed, based on evidence, based on what other jurisdictions are doing, and in consultation with our clinical experts from infection prevention and control as well as staff health, face shields are one of the important elements of personal protective equipment. So that as we develop our guidelines for different settings in the healthcare system as well as different priorities, the face shields are an important part of that. Often they are reusable if you can clean them with the right antibacterial. They're reusable most of the time, not always, depends on the product, but certainly PPE is really important, and when you can get that locally, when you can have reusable or reprocessable, it helps all of us. And actually, I think, looking towards the future, when we think about opportunities to improve our healthcare system, moving away from disposable when possible, it might be a really good opportunity to be more efficient with our resources, and support local businesses.
From the Winnipeg Free Press, Larry.
Dr. Roussin, just following up on the case of the trucking, the cluster around the trucking company in Brandon, has contact tracing determined how the initial person was exposed to the virus? Was it community transmission? Was it from another province or the USA?
Yeah, I do believe that the index case that you're referring to was a case that we were not able to link to travel or to being to a known case. So it'd be one that we would describe as a community transmission.
Can you tell? Do you have a breakdown for how many community cases have been linked to community transmission so far in Manitoba of the 280 some?
It's 11%. 11% of them are that what we would call community-based transmission, which excludes linking directly to travel or to a known case. So it's 11%, and in the last 7 days, there's been 0.
From Global, Will.
Good afternoon, everybody. Will from Global here. Mr. Siragusa, with so few cases in hospitals and very little evidence of community transmission happening at this point, some people are wondering when they'll be able to go to hospitals to visit their loved ones again. So we're wondering if you could talk a little bit about the timeline for that and what that might look like, please.
Yeah, our team is working on that right now as we speak, because we know that's super important for, people are in the hospital often because they're physically ill, but there's the whole spiritual and emotional part and being able to visit with your loved ones and your friends. So they are working on it. It probably won't be the same as what it was. It won't be free entry for everybody. We're still going to need to have the screening in place. We may encourage that distancing. We may look at outdoor visits if the weather is appropriate, because we still want to really minimize the spread of this virus. And so it won't be the same, it will be different, and we hope that it will be very soon. So stay tuned.
All right, thank you for that. My follow-up would be for Dr. Roussin. I'm wondering, are health officials considering opening up testing to anybody who wishes? And is that, how close are we to that?
Yeah, so the asymptomatic testing is certainly not as useful as testing those who are symptomatic. So right now we have it open to any Manitoban who's symptomatic, so fairly wide open. In certain circumstances, we'll be looking at testing asymptomatic people. So for instance, in a cluster that we've been talking about, we've tested asymptomatic close contacts there. We could look at testing new admissions to hospital or new admissions to long-term care facilities as well. So it's unlikely that we would ever be at a point where we would open up to anyone to the public to be tested if they're asymptomatic. That's probably not a very good use of it.
Thank you. We have a few moments left this afternoon, so if any reporters have further questions, please ask them now.
Yes, this is for Lanette. It's Bud again, Lanette. There seemed to be some confusion from myself and other questions regarding the N95 mask, and I want to make sure we're all on the same page. I, at least, have referred to the news release from Central Service Minister Reg Helwer regarding the 1 million made in Manitoba reusable silicone masks made by Precision ADM. No mention of the 3D. I just want to make sure you and we are talking about the same thing.
I don't know specifically that vendor, Bud. It was an announcement from who? The dentist?
Central Services Minister Reg Helwer this morning.
Oh, okay. Well, I'll have to follow up. I haven't seen that announcement.
So it sounds like what you're answering on something else other than the news release then.
Well, I was answering more just on N95 masks in general, that they come from different vendors and they come with different specs, really. Some are disposable, some are reusable. We know the paramedics right now, they're starting to distribute type of masks, same quality as N95. They're and that will be rolled out throughout the province. So those are reusable masks. So it's about the filter and it's about the seal, and then it's about, are they disposable or can you reprocess them? So I don't specifically know about the dental one, but I assume they all have the same principles. They have to have a certain filtration, a certain type of seal, and either they're disposable or they can be reprocessed.
All right. Well, these are not what I was referring to. I don't think others were. Perhaps there could be some clarity later today about what we were asking about those then.
Okay, sure. We'll follow up.
Thank you.
Larry Kush of the Winnipeg Free Press. My question is either for Dr. Roussin or Ms. Siragusa, whoever can answer. I'm just wondering if you're aware of any or many cases of folks waiting for a week or more for test results from COVID tests.
Yeah, I'm not aware of any specifics with that. I know that at the report from CADM Lab is our test turnaround time is about 48 hours right now, and so I don't have any specifics on that, whether it's negative results or what we're talking about. So I think we can look further into things like that.
What about Dynacare in Brampton?
Mm-hmm. Yeah, I'm not aware of any of the specifics. We're looking into some concerns that were brought forward, but I don't have any details on that as of yet.
Dr.
Just a question about, we've only seen a certain number of cases this week. Have all the cases in the past 7 days come out of this business in the Prairie Mountain Health Region? And if so, I guess what does that say about the rest of the province so far right now?
Yeah, so let's see here. So I'm not sure that certainly the majority of the last number of cases came out. We don't have any in the last 7 days. We have no community-based transmission that we would say. Our positive test rate in the last 7 days remains quite low. It is at 0.22%. And so I think what it says is that Manitobans have put us in a good position to safely start reopening the economy. And but we need to know that these numbers are a result of Manitobans' hard work and their patience. These numbers didn't have to be this way, and they don't have to stay this way. If we don't maintain our focus, we could certainly see a surge just like in other jurisdictions. So we're at a good spot, but we do have to be cautious. We have to make sure we protect those that are most susceptible to the severe outcomes. We need to protect places like the personal care homes. We need to protect remote isolated communities and do this reopening very, very cautiously.
Dr. Roussin, it's Jonas of City News. Actually, Scott was going down somewhere where I was thinking as well. Sorry to just ask for some more clarification on this, but from the time of that outbreak, how many cases were recorded outside of Brandon total since that all started?
Yeah, it's a good question. I don't have it right in front of me with that. So I can't really answer that. We know that we have these 8 cases that are connected, and we know that the index case is likely one that we would classify as a community-based transmission, and I believe that test came back April 27th, and so since then we haven't had a community-based transmission event. But I don't know offhand if there had been a couple cases that may not have been related to this that we also reported.
Thank you, sir.
Hi, this is Aiden from CBC News. I have a question for Dr. Roussin, and you already touched on this earlier, but just to expand on it, maybe many Manitobans are now starting to plan out summer vacations, and wondering if you could give any advice you have for Manitobans planning to explore the province this summer with cases.
Yeah, so it's, just that since the beginning of this, it's been a evolving situation. So it's tough to give firm advice for what's going to happen 3 or 4 months from now. I would say that, certainly there should be no plans for international travel. That's not going to be occurring this summer for non-essential international travel. Very, very unlikely that we'll be in a position to be recommending that. And then even interprovincial travel, we have to be cautious. Our numbers here in Manitoba, because of our geography, because of timing, have remained fairly low. That's not the case in many other parts of the nation. So it's going to depend on what's going on in jurisdictions outside of us. So I think it would be you'd be hard pressed right now to make future travel plans, because it's really tough to know where we're going to be at that time.
Right, sorry, Aiden from CDC again. I do have one more. Oh, sorry, go ahead.
Oh, it's Michelle from CCD. I just had a question for Lanette about gifts for Mother's Day going into healthcare facilities. Where can people call, or, if they wanted to give a gift, to make sure that it's okay if it didn't fall under the list that we gave earlier?
If it doesn't fall in that list, they want to do something exceptional. Well, I would say they should probably think about what they want to give, because they really don't want a lot of delivery people showing up, and so they could ask the personal care home or the facility, but I would suggest, just to be on the safe side, sticking with food, clothes, virtual visits as much as possible, because it's just, I think it might vary between sites, and I think having things coming into the PCH or people delivering is not ideal at this time.
Hi, Aiden from CDC again. Question for Dr. Roussin. Can you give us an update on the status of Manitoba's work on antibody testing?
Oh, I'm sorry, I didn't catch that.
Just get an update on any progress the province has made towards antibody testing.
Oh, right. So not no specific progress here. There's our lab's looking at a number of kits. There's a national task group looking at this, but we don't have any specific results at this time, or any specific plans to do a seroprevalence study. So it's still in the works. And we'll be able to provide some update hopefully soon on that, but nothing specific right now.
Thank you. And this concludes today's media briefing.